There is good news for the world. The Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, said he hopes to lift the COVID-19 emergency status this year. A panel of global health experts will meet on Thursday to decide if the virus is still an emergency, which helps maintain international focus on the pandemic. Experts say lifting the Public Health Emergency of International Concern, or PHIC, label could impact global funding or collaboration efforts. It is important to note that even if the emergency status is lifted, governments should still maintain testing, vaccination and treatment programs for COVID-19. As countries are beginning to lift their domestic states of emergency, such as the United States, there is a need to emphasize that the world is not out of the pandemic but has reached a new stage. According to Professor Salim Abdul Karim, a leading COVID expert, governments must work together to ensure the virus is managed effectively as people adjust to living with it, similar to HIV and tuberculosis. Many countries have been hit hard by the virus, leading to difficulties accessing care. In British Columbia, Canada, patients who are still suffering from long COVID after months of infection have reported feeling they've been left behind, now that the provincial government has closed 5 in-person clinics and opted for virtual care instead. Professor Marion Koopmans, a Dutch virologist on the WHO panel, says it is critical to communicate that COVID still is a complex public health challenge. Vaccines have been rolled out and there is hope for the future, with the US recently approving the world's first RSV vaccine for adults aged 60 and up. We will wait to see what the outcome of the WHO panel is this Thursday, but with the world looking for an end to this pandemic, there is a shared hope to overcome the virus together.